Assalamu alaikum warahmatullahi ta'ala wabarakatuh. Thank you very much for the organizing committee for allowing us to present on this very prestigious conference. And myself is Dr. Ahmed Idris, developmental pediatrician, Sultan Qaboos University, and my colleague is Ms. Dina Al-Khalili, General Manager in Al Jisr Foundation. We'll be talking today about nurturing care in action in Oman. The nurturing care framework is composed of 5 components: adequate nutrition, response caregiving, security and safety, early learning, and good health. If we had a look at the countdown to 2030, they set the indicators for the nurturing care framework. And if we look at those indicators, we can see that the country is doing greatly well in security and safety, with a birth registration of almost 100%. In regards to health sector, you can see that at that time, the treatment of HIV in pregnant women had no data at that time. However, 1 year back, Oman has been announced as the first country in the region to eliminate mother-to-child transmission of HIV and syphilis. At the area of early learning, we can see that early childhood education can be better approach. In regards to the early initiation of breastfeeding, it was really great, with 82% of women started early initiation of breastfeeding. But to continue on that, the exclusive breastfeeding needed to be improved. This figure is really affected by multiple factors. For example, if you look at the Oman data, we can see that the labor force participation rate for females is almost 30%, which is double the average in the MENA region. And that's one of the factors that affecting this. Lastly, at the responsive caregiving, we can see that multiple activities need to be conducted, and basically data are really needed on this area. One part of that data, and which is considered a challenge, that only 68% of children in Oman are developing on track. On the other hand, we have a major opportunity, which is almost all the live births receive a health check while in health facility or following delivery, either at home or in healthcare facilities. That will give us the impression that the health sector can act as a potential entry point for scaling up the nurturing care framework in Oman. While we are doing that, we need to keep in mind that the health system itself, 70% of its determinants are lying outside the health system. It depends on the economic stability, the social construct, and the environment, and education, and so other. That's why the philosophy of upscaling nurturing care in Oman has been incorporated into Oman Vision 2040, which set the framework for the governmental sectors to work together and basically to work in collaboration with private sectors and NGOs supported by the international organization. All these metrics are working all together to reach a common goal. I will leave the stage here to Ms. Dina to give us one example from Al Jisr Foundation on how NGO is taking this into action in collaboration with the other partners. Thank you very much.
Thank you. Thank you, Dr. Ahmed. Hello, everyone, and thank you for this opportunity to highlight our foundation's work and programs that aim to support families in Oman. Allow me to quickly introduce Al Jisr Foundation. Al Jisr means bridge in Arabic. We are an Omani private foundation that focuses on charity and sustainable projects in health, education, and social welfare. Al Jisr's core mission is to empower communities, ensuring that everyone has equal access to opportunities, and our ultimate vision is to serve as a trusted catalyst for sustainable impact and positive change throughout the country. Here you can see a quick summary of our mandate. To achieve our mission and vision, we have defined 2 main focuses. We have a charity side, covers social affairs, widely known as Band-Aid philanthropy. but is essential as it touches on a family's security and safety through our various charity aspects that ensure families lead a decent life. We have relief initiatives in providing rent and ration payments of utility bills, school tuition, and relief initiatives for prisoners, as well as housing. And then on the other hand, our sustainable programming with the 3 areas of focus. At the bottom here is what we have in place to maximize our impact. Though they're interconnected, in the next slides, I'm going to focus on examples of productive partnerships and collaborations. We believe in a multi-sectoral approach, and we always aim to maximize our impact by leveraging the potential partnerships and collaboration, in some cases as initiators of projects and in other cases as supporters. We've also gone through a couple of internal exercises to ensure that our projects align with national priorities like Vision 2040. It's also worth mentioning that the Jisr committed to the UNGC in 2018, making our foundation the first Omani NGO to sign it. We also find that our projects often contribute to some of the SDGs, at least goal 1 through 4, and through enhancing partnerships and multi-sectoral action, contributing to goal 17. I'd like to highlight 2 special partnerships we have in place. The first is with WHO Oman office. Our healthcare-centric program focuses on non-communicable diseases, treatment and prevention of. Al Jisr signed an MOC with WHO in 2021 that would span 3 years. We call it the Health Project. A main focus area is the prevention of the NCDs. To maximize the impact, we agreed to focus on 3 areas: nutrition, physical activity, and mental health. But of course, it has very specific objectives, which I won't get into right now. The main beneficiaries of the project are children under 5 years and their families, as well as school children, adolescent girls, and pregnant women in terms of nutrition interventions, as well as the youth, the community at large for all proposed intervention areas. It goes without saying, of course, that close collaboration with the government is mandatory to ensure alignment with national priorities, sustainability, and ownership. The second partnership is with Sultan Qaboos University, SQU. We signed almost a year ago to fund the establishment of a pediatric development center. And I'm not just referring to it because of my SQU colleagues present here today, but because what makes this collaboration exceptional is the fusion of the civil institution with the public sector represented by this esteemed academic institution. This collaboration goes beyond merely advancing medical knowledge and research, as it is dedicated to providing unwavering support to children and their families and a nurturing environment where they can find solace and empowerment. With a primary focus on early detection, intervention, disability reduction, and management, this center will prove to be an invaluable resource for parents, from providing guidance and counseling to offering practical assistance. We've also ensured to include concepts like the Family Education Unit, Patient Care or Patient Experience Center, and assistive and immersive technologies. My last slide provides country-level examples of more programs that were developed to support parents and their children. On the left here, you may recognize this manual, as we've joined forces with SQU and WHO to advocate for care for child development. Through the adaptation of all the training material, we aim to develop a nationally contextualized CCD package that will be validated and then recommended for use by all service providers working with children aged 0 to 3 years in Oman. This is currently. We also hope to support the rollout of the training of caregivers and supervision strategy for the care for child development approach. We've also funded the participation of parents of children with autism from all over Oman to the Gulf Autism Conference, GAC 2020. This ensured their access to information and opportunities, in addition to bringing these parents together to create a support group of their own. We've also provided grants to local NGOs, mainly the Association of Early Intervention, to ensure that their crucial services continue being offered to children in need free of charge. The logos on the top are awareness campaigns, the exclusive breastfeeding campaign, and the National Nutrition Campaign. These are partnerships with the Ministry of Health. In addition to supporting the implementation of health-promoting schools with WHO and the Ministries of Health and Education. At the end, I would like to say that through our meaningful partnerships and impactful programs, we continue to build bridges of hope, empowerment, and positive change for families in Oman. Thank you.